Welcome back to my channel. In this video, I will be discussing about the maxillary major connectors, which is an important part of the framework of the RPD. So we will be discussing it under various headings like design, indication, contraindication, advantages and disadvantages. So I have added the photographs as well to help you to remember it in a more precise manner. So as you can see, the first one, it is just a bar, right? So we will write it as single palatal bar. Now, the thing that you need to remember in a single palatal bar is that it has a width of less than. So first of all, just remember one point. It has a width of less than 8 mm. This is the most important thing that you need to remember in this. Then you need to remember that it is half oval in cross section. All right. Now in the indications, it is as you can see, it is preferred for Kennedy class 3. All right. Only when one or two teeth are missing, not more than that. But if asked, mostly it is used for interim partial dentures. All right. Now contraindications are the distal extension designs, distal extension situation. Now which is the distal extension? It is class 1 and 2. Basically any that has unilateral or bilateral posterior edentulous area. Also one more contraindication when anteriors are missing. All right. So this is our single palatal bar, and for the disadvantages you can write that it is difficult. Basically it is most difficult for patient to adjust. Then it is basically it does not derive any vertical support from palate, and relies on natural abutment tooth. So there is more stress, right? Now coming on to the second one. In the second one, you can see that it is somewhat similar to the first one. So it is basically a single palatal strap. Now in this, width is more than 8 mm. This is the contrast point. Then you will see that it is indicated same indications class 3 when one or two teeth are missing and the need for palatal support is minimum. All right. Now in contraindication, same indication is class 3 and contraindication is class 1 and 2 and when anterior are missing. All right. Now advantages is it is better tolerated by the patient and need for palatal support is minimum, and it has better resistance to twisting and bending. All right. Now then coming on to the these are the key points. Then coming on to the third one. Now in this, what you will see is basically in bar just remember less than 8 mm and in strap remember more than 8 mm of it. Now over here what you will see is in the third one you have a bar on anterior side and posterior side. So as the picture is telling you, so it is an AP palatal bar. All right. Now in this, what happens is you need to remember the anterior and posterior. So anterior में you have to remember that it is basically flat, narrow, and posterior is half oval in cross section. Now because this and this are in different orientation, they give a L-beam effect. Now what is L-beam effect? L-beam effect is basically they both are in two different planes, so they will add to the rigidity of the structure. Now coming on to the indications. In indications you have to remember that first one is the torus platanus, then class 4 cases, distal extension. All right. Then a contraindication you have to remember when there is reduced periodontal support of abutment teeth. Advantages: excellent rigidity, less coverage of maxilla. And in disadvantages, it may interfere with speech, frequently uncomfortable. All right. Then coming on to the first, second, third, fourth one. In this, basically you have AP, right? That you can see. Then you have palatal also, but you have a strap now at the posterior, and you can see that, right? So in AP, what you see is same thing. It has an anterior component and a posterior component. All right. They also basically more than 8 mm wide at least. All right. Same thing. But in this posterior palatal connector, it should be as posterior as possible to avoid interference with the tongue. Then it will also show you the L-beam effect. All right. Now in indications, same indications, class 4 distal extension cases and inoperable palatal torus. All right. And then in the advantages, what you will see is that it is having rigidity, excellent rigidity, patient comfort is increased, then wide indications. Now in disadvantages, it may interfere with phonetics, and there is significant coverage of palate. Now coming on to the second last. In second last, you will see that it is horseshoe shaped, right? So in horseshoe shaped, what you will see is, first of all, we will write the name. It is horseshoe shaped palatal connector. Now in this, basically, in the first point is that it resembles the horseshoe. Now here what you can see is see this part. You can see that it has an anterior part, but it does not have any posterior component, like there's no connecting posterior component, right? So the main advantage of it is that it can be used in large inoperable torus that extends to soft palate, and another is that it can be used in exaggerated gag reflex cases. Then it lacks rigidity, that is the disadvantage. Plus there is bulk addition and there is tongue interference. Usually this is not used now. All right. One important point you can remember is that the borders of the horseshoe, they should be around 6 mm away from marginal gingiva. All right. Now coming on to the last one, which is the complete palate. Complete palate. Now this is like it has a full palate connector. Now in this, you should remember that the anterior component 6 mm away from marginal gingiva, and the posterior component at junction of hard palate and soft palate. All right. Now in this, there is one. First we can write about the indications. Now indications are important in this one. So first is that you can use it in distal extension cases easily. Then you can use it in flabby tissue. Then you can use it in cleft palate patients. This is the most commonly asked MCQ. In cleft palate, which connector will you use? So you will talk about that. You will use the complete palate one. And then there is flat arches in which you can use. And then there is one more in which the opposing arch is completely edentulous. Matlab mandible is basically dentulous and the maxilla is edentulous, right? Right. Then there is one advantage. There is an advantage in this. What we do is we do beading at posterior border to allow for positive tissue contact. Disadvantage is phonetic problem and can lead to soft tissue reaction. Contraindication, you can remember large torus present, then you will not use it. All right, then I think this much is done. Now let's just sum up again. So first of all, maxillary major connectors. So let's just revise it. So width, when it is less than 8 mm, it is a bar. When it is more than 8 mm, it is a strap. In class 3 cases, important in clinically intent partial dentures in class 3, distal extension you will not give. Oh, all right, and when anterior teeth are missing, same point. Then it is half oval in cross section. Now this you need to remember key single palatal bar mein and single palatal strap mein, which is better tolerated by the patient, it is a single palatal strap. All right, then AP palatal bar and AP palatal strap, same thing. In this, important thing you should remember is the L-beam effect. All right, both will show L-beam effect. Most important indication is the torus palatinus and class 4. All right, then in this, yeah, this much is enough for you. Then in horseshoe shaped, you will remember that there is no posterior connection 6 mm away from the marginal gingiva. The interior part should be common indication is the large inoperable torus that extends to the soft palate and exaggerated gag reflex. All right, then complete palate, same point, 6 mm away from marginal gingiva, posterior is at the junction. Now, if you're asked that if in case of distal extension, which one will you prefer? So usually in the book it is given as complete palate. The most common indication of a complete palate is distal extension case. The statement is like this, and in cleft palate also. One additional point you should remember that there is bleeding done at the posterior border, which allows in positive tissue contact in the complete palate. I hope I made maxillary major connectors easier for you to understand and remember. In case you like the video, do subscribe to my channel, and yeah, thanks for watching.